Hi, my name is Melissa Husky. My ID number is E3344031, and I'm taking the class of Veterinary Technology for summer of 2020. In this video, I'll be demonstrating how to place a dog in lateral recumbency in order to perform the lateral saphenous venipuncture. Lateral means the side of the dog, recumbency to lie down, so the dog will be lying down on its side. This restraint is best for the lateral saphenous vein, which runs along both of the hind legs here between the distal and the hock. You also want to make sure your dog is on a noose leash at all times for better control. To place your dog in lateral recumbency, I'm going to take my arm around her neck area, bringing my arm around and grabbing the leg that's closest to me while moving my hand towards the back of the hip here, grabbing the leg that's also closest to me, pushing against my body and lowering down in lateral recumbency. Both of my forearms are used as a brace to help keep her still between her neck area and her hip area. As you know, the lateral saphenous vein runs along both between the distal and the hock, the back leg here. I'm going to place my thumb around the stifle area and then place my other fingers on the back part of the stifle area, giving it some pressure for the vein to pop up nicely. The doctor or the vet technician then will come in, palpate the vein, then draw blood. After you get the okay, I'm going to release pressure and place my finger where the needle was injected for about 15 seconds. After that, to place your dog back up safely, I'm going to release the back end of the legs. I'm going to bring my arm around her neck area, bringing her up in a standing position while maintaining control, and then she's done. Hi, in this video I'll be demonstrating how to place a dog in sternal recumbency in order to perform the cephalic venipuncture. Sternal means the front of the chest, recumbency is to lie down, so the dog will be lying down on its chest. You want to make sure you have a noose leash on your dog at all times so you have better control. This restraint is best for the cephalic vein, which runs along the front of both legs here. To put in sternal recumbency, I'm going to place my arm kind of around her head, and you want to have good control at all times. Placing her slowly down to the table in sternal recumbency, then to extend the leg. To then occlude the vein, I'm going to wrap my thumb around near her elbow, do a semi-turn, and towards outwards. The vein should pop up nicely. Then the doctor or the technician then will come in, palpate the vein, then draw blood. After you get the okay, you want to release pressure from the elbow, placing where they drew the blood for about 15 seconds. It's okay. Then to release your dog and bring her back up safely, you want to slowly lifting her back up into standing position, and then she's done. In this video, I will be demonstrating how to place a cat in lateral recumbency in order to perform the medial saphenous venipuncture. Lateral means the side of the cat, recumbency is to lie down, so the cat will be lying down on its side. You want to make sure you have a blanket or a towel underneath to help them feel comfort, as well as continuing to stroke your cat, help them feel relaxed in the situation. This restraint is best for the medial saphenous vein, which is in the back legs here and the inside. To put your cat in lateral recumbency, you want to get first a good scruff between the head and the neck. Then I'm going to take my other arm and wrap it around her feet area, slowly sliding, lowering her down on her side. My arm is going to be a brace for her back to help keep her still. I'm going to then keep put her leg and her tail next to her body, while the vet or the technician then will come in and then extend the leg. Then to occlude the vein, I'm going to place my hand with light pressure on the high part of the thigh. Then the doctor or vet will come in, palpate the vein, and then draw blood. After you get the okay, she will release pressure from the leg and then place your finger where the needle was injected for about 30 seconds. After that, to safely pick your cat back up, I'm going to bring my arm under her belly, bring her back into a comfortable position, petting her and telling her that she did a good job. In this video, I will be demonstrating how to place a cat in sternal recumbency in order to perform the cephalic venipuncture. Sternal means the front of the chest of the cat. Recumbency is to lie down, so the cat will be lying down on its chest. You want to make sure you also have a blanket or a towel underneath for comfort while continuing to pet your cat to help them feel relaxed in the situation. This restraint is best for the cephalic vein, which runs along both of the front of the legs here near the crook of the elbow. To put your cat in sternal recumbency, you want to have them lying down, scooting them towards the edge of the table, moving the head towards away from the leg that I will be drawing blood. You want to then extend the leg. There we go. To occlude the vein, I'm going to then wrap my thumb around near the elbow area, do a semi-turn outward. The vein should then pop up nicely. I will then, or the technician or the vet will come in, palpate the vein, then draw blood. After you get the okay, I'm going to release the pressure from the elbow, placing where the needle was injected for about 30 seconds. After that, to safely bring your cat back up, bringing them to a comfortable position from the table, just kind of petting them, relaxing them, and letting them know that they did a good job.